Please like, share, comment, and please subscribe. Welcome back to our channel where we break down the latest evidence in kidney care. Today we're diving into a critical topic: how we measure and manage fluid or volume in patients undergoing long-term dialysis. For these individuals, getting fluid balance right is a constant challenge. The goal is to reach their dry weight after each session. That's the body's weight without any excess fluid. But what happens when we miss that target? Too much fluid left behind, known as fluid overload, can strain the heart and raise blood pressure. Removing too much, too fast can cause dangerous drops in blood pressure and cramping. This is based on a 2025 review in the Journal of the American Society of Nephrology by Lazarus, Davies, and Polkinghorne. Let's explore what the evidence tells us about the best tools for the job and why accurate fluid management is so essential for improving health and quality of life. First, define dry weight. Your weight without extra fluid. Each visit, we aim to finish near this number safely and steadily. Fluid overload is a major risk factor for hypertension, left ventricular hypertrophy, and cardiovascular mortality in dialysis patients. On the other hand, overly aggressive fluid removal can cause intradialytic hypotension, ischemic injury, and reduced quality of life. Striking the right balance is one of the toughest challenges in nephrology. Goal for each session: pre-dialysis weight minus target dry weight plus planned fluids. For example, if the pre-weight is 72 kilograms and the estimated target dry weight is 70 kilograms plus 0.5 liters of planned fluid, that equals about 2.5 liters to remove. This review highlights that there's wide variation in how dialysis units assess fluid status. Some rely heavily on clinical judgment, looking at blood pressure trends, edema, or patient-reported symptoms. Others use technology like bioimpedance spectroscopy, lung ultrasound, or relative blood volume monitoring. But here's the problem: there's no universally accepted gold standard. Keep ultrafiltration gentle. Aim under 10 milliliters per kilogram per hour. Avoid above 13. Lower rates feel better and protect the heart. To accurately assess a patient's fluid status, we have several evidence-based tools at our disposal. It's important to remember that no single tool is perfect. The real power comes from combining their insights to get a complete picture. Let's break down the most common methods, starting with the foundation of patient care. First is clinical assessment. This includes a physical exam, checking for swelling in the legs or listening to the lungs, and tracking trends in weight and blood pressure. It's the most widely used approach because it's accessible and non-invasive. However, its interpretation can be subjective, varying from one clinician to another. Next, bioimpedance spectroscopy, or BIS, offers an objective look inside the body. By passing a tiny painless electrical current through the patient, it precisely measures the amount of fluid outside the cells, known as extracellular water. This data provides a more objective number to help guide adjustments to a patient's dry weight. Lung ultrasound is another powerful tool. It allows us to directly visualize fluid in the lungs, which appears as vertical lines called B lines. Think of them as little rockets of fluid. A higher number of B lines indicates more congestion and is strongly correlated with outcomes like hospitalization risk. During a dialysis session, relative blood volume monitoring tracks how much the blood plasma volume decreases as fluid is removed. This helps clinicians avoid removing fluid too quickly, which can cause a sudden drop in blood pressure. However, it's a snapshot of the treatment itself and has limitations in predicting a patient's long-term fluid status. Finally, biomarkers like NT-proBNP and troponin are blood tests that can indicate heart strain, often caused by chronic fluid overload. While they can be a helpful piece of the puzzle, their levels are influenced by kidney failure itself, so they are used as adjunctive information rather than a routine guide for setting dry weight. So what does the literature suggest? Use a multimodal approach. Combine clinical judgment with objective tools. Avoid rigid targets. Instead, individualize dry weight based on patient comorbidities and tolerance. Monitor trends over time rather than single measurements. Prioritize patient-centered outcomes, fewer hospitalizations, better blood pressure control, and improved quality of life. The authors emphasize an urgent need for randomized controlled trials to compare different strategies. We need stronger evidence to guide practice, especially in integrating technology into routine care. Until then, nephrologists should adopt flexible, evidence-informed approaches tailored to each patient. Time matters. Longer sessions spread removal and lower ml per kilogram per hour. Big goals? Add time, don't pull faster. So let's bring it all together. We've seen that managing fluid volume in dialysis is a delicate balance, truly both an art and a science. Getting it right is not just about numbers, it's about protecting your heart from strain, keeping your blood pressure stable, and ultimately improving your quality of life between treatments. The best practice today moves beyond relying on just one method. It's about blending the irreplaceable value of clinical expertise, the physical exam, and listening to the patient with the powerful objective data from tools like bioimpedance spectroscopy and lung ultrasound. This multimodal approach gives us a much clearer, more reliable picture of a patient's true fluid status. For clinicians, this means embracing a workflow that integrates these tools to create a personalized, adaptable plan for each patient. For patients, this is about empowerment. You are the most important member of your care team. Don't hesitate to ask questions. Inquire about how your dry weight is being determined and tracked over time. By working together, using the best of our clinical skills and our technology, we can achieve safer, more effective dialysis and better long-term health. Come on time, finish every minute. Safer removal and fewer crashes. Thanks for watching. Like, share, comment, and subscribe.